Hello everyone, good afternoon. So we will just wait for another 2-3 minutes until everyone joins and then we'll begin. Okay, let's start.
Yes, okay. So, hello everyone. Welcome to our live question and answer session on the importance of counseling in cancer care. Today, we experts here from three crucial areas: diet, genetics, and psychology. We'll share our insights and answer your questions. Our goal is to help you understand how these aspects contribute to better cancer care and recovery. So, before answering our audience, let's have a quick glance about the events of each counseling. We can start with the genetic counselor first.
Okay. Everyone, good afternoon. Shalini, I'm a genetic counselor at 4 Base Care. So, let me help you understand what is genetic counseling. So, genetic counseling helps patients and their families understand the inherited risks of cancer. By analyzing family history and genetic factors, we provide insights into personalized treatment options and preventive strategies. So, let us first understand what is genetic counseling. So, to understand genetic counseling, we need to understand the role of genetic counselors. So, genetic counselors are trained healthcare professionals in the field of genetics who can help you understand your hereditary risks, suggest appropriate genetic tests, and help you manage an inherited risk of cancers. As a genetic counselor, we also educate patients and professionals about genetic diseases and different kinds of genetic tests available. We also help patients interpret the genetic test results and guide them and their treating oncologist in further action based on their report findings. So, genetic counseling is very crucial in cancer as it helps in understanding the risk for inherited cancer from the family history evaluation, as well as screening for future risks of cancers and management for the family members who could be at a potential risk. So now, Jaitri can emphasize the importance of psychology in cancer care now.
Thank you, Shalini. My name is Jaitri, and I'm the senior psycho-oncologist from Forbes Care, Bangalore. Before starting today's discussion, let's talk about why taking care of mental health or psychological health is so important when you are receiving the cancer treatment. Because here we need to understand that mental health is always the key in cancer care because it's help you to manage your anxiety, your whiny cognition, any type of distress, your loneliness, and also the psychosexual issues as well. Psycho-oncology counseling can help to improve the mood, challenge negative thoughts, reduce treatment non-adherence, fatigue, and even it can boost your confidence as well. For example, a simple here and now approach or strength-based, solution-focused approach can help patients to focus on the actionable steps, enhancing both the patient's and the caregiver's quality of life during the entire treatment process. So here also we need to understand that as a patient or as a caregiver, what you can expect during a psycho-oncology counseling session from Forbes Care. Here, I would like to address that from Forbes Care, we provide not only the psychological support to the patients but also to the caregivers as well. And there will be multiple psychological counseling sessions, for example, session 1, session 2, and follow up sessions as well. Here, during a psycho-oncological counseling session, psychologists we try to assess the psychological and the social factors, including your sleep pattern, your distress level, if you have any body image issues, your anxiety levels, coping strategies, and even your entire lifestyle pattern as well. For example, let me add here when we try to assess the sleep pattern, psychologists we can discuss the sleep hygiene practices, which includes the consistent sleep wake cycle, focusing on the here and now approach to reduce the stress. As I said earlier, psychological counseling sessions offer absolutely personalized counseling for both the patients and the caregivers, I mean the family members. So here, I will request Sharmela, can you please tell about oncodietitians and the diet counseling?
Oncodietitian is an expert in dealing with cancer patients' dietary requirements. During various cancer therapies, it's a big question mark what to eat and how to eat. By the time patients' family think about this, side effects knock the door, being a great hurdle for cancer patients to eat a proper diet. So, some common side effects like nausea, loss of appetite, and changes in taste makes it difficult even to complete the three main meals. This ends up in malnourishment because the patients do not get enough calories, proteins, and other nutrients to tackle the battle. Only a qualified oncodietitian can help patients throughout their treatment journey. So, good nutrition also play a key role in boosting the immunity, helping the body fight infections and recover faster from surgeries or treatments. Additionally, it improves treatment tolerance. While patients are well nourished, handling the side effects of therapies will be actually easy. I would like to add that it also enhances their emotional well being, helping them feel more energized by improving their overall quality of life. Here at Forbes Care, we oncodietitians analyze the nutritional status of the patient. Also, we check the blood parameters values to see whether they are anemic or not, is there a need for neutropenic restrictions or not, and then provide the tailored nutritional advice. We also do follow up with patients to make sure the treatment journey is smooth for them and help if there are any ups and downs in the side effect symptoms, also the blood parameters.
So, in our previous live session, we received several important questions, and while we addressed many of them, a few remained unanswered due to time constraints. So, in this session, we are here to continue that conversation, starting with those unanswered questions from last time, followed by the new questions from you today. Let's dive right in and address them one by one.
Yes, I remember one of the audience, Shilu's query was about hydration and fluid requirement during chemo and radiation therapy. Let me tell you all why being hydrated is important. To flush out the toxins from the body, to reduce side effects like fatigue, dry mouth, and constipation, to support the kidney functions, preventing the damage from medications, and to maintain energy levels and improve the overall well being. Being hydrated is very, very important. I usually recommend 2 to 3 liters of fluids per day, sometimes even more than that, depending on the patient's condition and treatment side effects. It is not 2 to 3 liters of water per day, it is fluids per day. So, for example, like tender coconut water, buttermilk, soups, or herbal teas also can be considered to meet the fluid requirement. And avoiding sugary drinks and excessive caffeine, which can cause dehydration, is something very important to be hydrated. So, because it is dehydration that causes dizziness or confusion and even dry mouth. So, also the query from Mr. Tyagarajan about the management of sore throat also must be clear now.
Thank you, Sharmila. So, as you said that we got many questions in our last sessions. So, I can also remember like one patient asked, I guess he is Sam. So he asked that, ma'am, there is a severe hair fall after the chemotherapy for his or her mother, and the mother is so much hesitant to even step out. Can we do something about it? So here, let me give you the answer that yes, first of all, uh, sir, you need to be very careful when you are explaining a few tips to your mother because it's a hair fall, which is very one of the most common side effects of receiving the chemotherapy. Here, we need to understand that you can explain it to your mother very carefully that this phase, which is hair fall or alopecia as a side effect of chemotherapy, this is absolutely a temporary phenomenon. It means the day your chemotherapy will get over, within 3 to 4 months, the new hair will start regrowing. And surely then she will be able to enjoy the new quality hair once again. Having said that, as you said that she is not so much interested to step out, definitely because of the body image issues, which is a very significant psychological condition which can create very severe distress within women as well. Here you can always suggest her wig is known as false hair that our patients can take from any rehabilitation center. Number two, also you can suggest her to cover her head with any dupatta or probably sometimes shawls, chadar, anything, any good clothes, and even turban as well. So here you can explore from any sites, whatever you feel that you will be comfortable with. Answer number three, it's very important that your mom should be able to accept herself the way she is looking now because always we say that bad is beautiful. So from the family also you can always tell your mom that whatever way she is looking now, that's the best possible way. So it's absolutely fine because it's always a temporary phenomenon. Thank you.
Okay. So we'll start addressing few of her questions. So a patient has asked who should consider genetic testing based on family history. What types of cancer genes are tested? What implications do positive results have for cancer risk and prevention? So, it is a very good question to address here. So, who should consider genetic testing is basically individuals who have a strong family history of cancers up to 3 generations, which is running in the family. And the type of genetic testing ideally suggested is a germline genetic testing, which is performed on the blood sample. So, based on the blood sample testing, that is a germline genetic testing, if a result turns out to be positive, it means that the person can be at an increased risk of potential cancers in the future. And the preventive measures would be based on the genes that we evaluate. So certain genes have risk for certain kinds of cancers, so accordingly a preventive management plan will be suggested. So for that I would request the person to contact the genetic counselor and get yourself evaluated.
So there is a question from Dr. Shivakumar. If side effects are severe, shall we stop chemo tablets temporarily? So, regarding the medication, it is better to get consultation from the doctor. But when it comes to side effect management, especially nausea, there are many anti-emetic property foods that is available in and around us. Few examples are mint leaves and ginger. So by incorporating mint and ginger into our daily diet, at least like a green tea, will actually help us managing nausea. Okay, so apart from nausea, there are few other effects also. Also considering the comorbidities here is something very important for the dietitian. So always consult the onco dietitian to get the details even more better. So you can manage the side effects efficiently. So when the side effects are managed efficiently, sure that treatment tolerance will be better.
So, Jaitri, we have a question for you as well. As we
Okay.
spoke in the session, Jaitri ma'am, my father is still smoking, even if it's very less. Can you please suggest something?
Surely, sir. And thank you, Shalini, for addressing this question as well. So, first of all, I would like to say that smoking, if someone is smoking for a long time, then surely uh, it's not so easy for him or to her to quit in a single day. So here the strategy is either the psychological or physiological or medical. The strategy should be very systematic and step by step, and surely with the consistent monitoring from the family members and surely the doctors as well. So here from the psychological part, let me address a few things. I guess that is going to be very much helpful. Number one, that which is very important here, that we call it the deep breathing technique. So whenever you feel that there is a strong urge and you need to smoke, you can always tell your father that always try to practice deep breathing, which is take slow deep breath to calm your nervous system and inhale deeply through your nose and hold for a few seconds and try to exhale slowly. So what will happen after this will help to reduce the immediate physiological response, for because you are now your father is craving for the nicotine. And number two, we also need to understand that there is a concept called we need to avoid the triggers. What is avoid the triggers? Number one, we need to identify and avoiding triggers. So understand the situations, emotions, or the places that make you want to smoke and develop some strategies to avoid or to cope with that. Also, you can try to change the routine, for example altering the daily routine that is associated with smoking, because many people they have the habit of smoking after meals or with the coffee can also help that habit. Number three, also, sir, you can try that. Try to set a quit date, which is commitment to quit. What is that? That try to choose a particular date to quit and prepare for it by gathering, support. Try to remove all the cigarettes from your house, because we have seen that sometimes most of the people they try to hide the cigarette either in the washroom or probably in a small drawer. So I guess these are the very small things. So slowly and gradually you can cut down that number of cigarette consumption before quitting it abruptly. And even after that, sir, if you feel that no, your papa is not getting the desirable result, then surely feel free to connect with any oncologist. So there is a technique called NRT, which is the nicotine replacement therapy in terms of any nicotine gum or in many other products are also there. So these products can also be very much helpful for your father to stop and to quit smoking as soon as possible, I must say. Thank you.
There is one common question that is asked. This is something that is repetitive during my session also. How to deal with constipation? So to deal with constipation, it is necessary to understand why does constipation occurs. So constipation occurs only because of two main reasons. Number one, lack of fiber, and number two is lack of fluid intake. So as I told, being hydrated is something very important even to deal with constipation. So when it comes to fiber intake, better inclusion of fibrous vegetables such as green leafy vegetables, broad beans, nuts, seeds will actually help in improving the fiber intake and help in treating constipation. And I can give one simple trick that could be used by all the cancer patients during the cancer treatment, such as chemotherapy and radiation therapy, is that inclusion of 1 tablespoon of flax seeds into their dinner. So inclusion in the dinner is very important than in any other timings throughout the day. So including these flax seeds will actually help in improving the fiber intake and tackle the side effects, other side effects, also in tackling the constipation. So this is not like following just for 1 or 2 days. It has to be taken throughout the treatment journey, so that getting rid of constipation is something, one main thing that we have to follow during the therapy. Because being constipated also sometimes will make the patient weak.
So there was
Okay.
one question addressed by Satya D. We take genetic testing for my mother, and the result came out to be likely pathogenic variant. What it means? Diagnosed with HER2 positive breast cancer. So basically, genetic test report that which mentions likely pathogenic variant, it means that a disease causing variant with limited evidence has been has been identified in your mother. So again, I would suggest to get yourself checked with the genetic counselor who can help you provide a further management and treatment related options.
So here I can see one question by Shweta Gupta. So Shweta Gupta ma'am has asked, that, ma'am, we are not sure whether to let our father know about the diagnosis. What can we do? So, ma'am, it's a very common concern that most of the caregivers reports to us during the psychological counseling. So here we need to understand that as a caregiver, probably you are thinking that the patient doesn't have any idea about the diagnosis, about the treatment. But what happens usually when the patient visits the hospital for a few sessions or probably for chemotherapy surgery? So automatically they start getting some sort of idea that probably my children, they're hiding something from me. So I would like to suggest you, ma'am, that first you sit with your uh, just you sit with your father and try to understand or to get a clarity that what is his level of understanding about the diagnosis. So if you feel that no, father doesn't know anything about it, so then this is one different discussion. But if you feel that your papa really have certain idea about the diagnosis and the treatment as well, so I think it will always be better if you explain the diagnosis without any medical jargons in a very simple manner, and surely don't forget to take help from your oncologist or probably any psychologist who will help you to navigate this process, because in that time your papa can also ask many medical questions and probably it's going to be very difficult for you to answer all the medical small things as well. So always we suggest that as per the patient's personality, and if the patient has partial knowledge about the diagnosis and the prognosis about the treatment and also the cancer diagnosis, then it's very important that let's have a very simple conversation so that also they can also feel empowered and they can also try to understand that no, whatever treatment is going on inside my body, it's as per my wish, my will. So I guess you have got your answer.
I can see Ajay Mahajan has written, my one type of chemotherapy is completed, and after that 3 months with other chemotherapy medicines, now I am suffering from severe neuropathy in leg. Please suggest diet plan. So, like when there is severe neuropathy, it cannot be dealt just with few lines telling like this is what the diet you have to be followed. So, like for example, there are many fancy diets that can be followed for weight loss, but it is not applicable when it comes to cancer care. So when it comes to cancer care, management of comorbidities, side effect management, and also this neuropathy have to be addressed everything in detail. So I can suggest you to actually avail one diet counseling session in detail, where we or dietitians at Forbes Care can help you thoroughly throughout your journey.
So here I can see that someone has asked in terms उनका नाम है questioning maestro. So यहाँ पे आपने जो पूछा है, क्या मैम मेरा नाम है बबीता कुमारी और 1 ईयर से 1 साल से आपका मेटास्टैटिक लंग कैंसर की पेशेंट हूँ और मुझे आपसे कुछ पूछना चाहती हूँ. सो मैम आपको मैं रिक्वेस्ट करूँगी बबीता जी, आपका जो भी सवाल है, आपका क्या रिलेटेड सवाल है, अगर आपको आपके डाइट के बारे में या साइकोलॉजी के बारे में, आपको जेनेटिक टेस्टिंग के बारे में या आपका मेडिकल कुछ भी आपको इलाज के बारे में अगर कुछ भी सवाल है बची तो आप यहाँ पे लिख सकते हो सो दैट हम लोगों को समझने में और आपको मदद करने में आसानी हो. अभी मैं बबीता जी आपने हम लोगों को और एक सवाल पूछा है, वो है आप 1 साल से मेडिसिन ले रहे हैं और कंटिन्यूइंग कीमोथेरेपी आपका चल रहा है, फिर भी आपका स्प्रेड हो रहा है, क्यों? बबीता जी आपको मैं रिक्वेस्ट करूंगी, आपके जो ऑन्कोलॉजिस्ट जो आपका इलाज करवा रहे हैं वही बेस्ट पर्सन है मैम आपका जो ये सवाल है उसका उत्तर देने के लिए और आपको डिटेल में समझाने के लिए. तो मैं रिक्वेस्ट करूंगी आप नेक्स्ट वीक अभी जब फॉलो अप विजिट में जाएंगे ऑन्कोलॉजिस्ट के पास, विदाउट एनी हेजिटेशन, कोई भी हेजिटेशन ना करके आप उनसे प्लीज आप ये सवाल पूछिए सो दैट आपको भी एक प्रॉपरली क्लैरिफिकेशन मिल जाएगा. थैंक यू मैम.
Jaitri, there's a question for you. How can personalized nutrition based on genetic factors help improve the mental well being of cancer patients during treatment?
Okay. So,
Okay, so
Shalini, I guess
yes.
Sharmela will be the best person, and you as well for
Yes,
answering.
actually, here the part of both dietitian and psychologist come because they are asking about the mental health. So when it comes to mental
Yes.
health, yes, there are yes, the dietary factor is actually related to everything. The question is actually related to all the three of us. Yes, so genetic, diet, and psychology, everything came together. There are food that is like that has a very great factor when it comes to genetics. That is true. And so apart from that, when it comes to the psychological factor, yes, so we must make sure that the patient is they had their food well before going to sleep. They must complete their dinner well. Incomplete dinner also might actually help the sleep pattern. There are possibilities when the person cannot meet their nutritional intake, when they are not able to eat properly due to some kind of side effects during the treatment. Yes, of course they cannot sleep well. Okay, so eating properly is something very important when it comes to sleep properly and also maintaining the psychological health. So when I spoke about hydration also, I actually highlighted telling also to be energetic. Being hydrated is important because being dehydrated may actually bring down the energy levels. So eating well is very important to be mentally stable. That is something very important. And Jaitri, actually you can continue answering, giving them few more tips to be calm, mentally stable along, because I have completed my part saying them to eat well. So also they can avail the sessions to speak in detail. So I'm not sure whether what are the comorbidities the patient have and what is the CBC values. Maybe if that was shared, it will help me to elaborate them. Okay, so maybe you can give few more tips on how to be mentally stable and calm down and keep their energy level stable.
Surely, thank you, Sharmila. The question is always very interesting, like how the psychological and the diet and the GNT counseling, like everything is sort of correlated with each other. So, sir, I do completely agree with Sharmila here that first of all, we need to understand that as because the patient is experiencing certain side effects, it's not only about the diet pattern, your entire sleep cycle, which is known as the sleep wake cycle, and even your day to day schedule, everything will be getting activated. I mean, everything will be getting completely, I must say, sometimes distorted. So it's very important that whenever we talk about lifestyle, so inside the lifestyle we include everything. Number one, the diet pattern. a very healthy lifestyle. Number three, it can be some sort of physical exercise, certain levels of yoga, sometimes deep breathing exercise, and also stress management techniques as well. So everything is very much intercorrelated. Here we need to understand, as Sharmila said, that the moment I am able to have good amount of food, like good amount of quality food, then surely, and after that, if I'm managing a good sleep wake cycle, it means I'm going to bed at the right time each and every day, and also I'm waking up at the right time during the daytime. Number two, if I'm practicing certain type of very mild stretching, I'm going for morning walk probably for 20 minutes. I'm, as Sharmila said, that the body should be hydrated always. And also throughout the day, if I am trying to engage myself as much as possible, either through some simple household chores or my own work or any hobbies or probably helping the other family members or probably anything like reading, writing, and whatever I like to do, inculcating some new hobbies as well. So it means that you are not always thinking about the cancer related negative thoughts, rather than you are utilizing your time in something much productive way. So surely we need to agree here completely that yes, the genetic counseling sessions, the dietary patterns, and also managing a very good healthy lifestyle and mental health can be very much beneficial for the overall well-being and the quality of life for the cancer patients, also for the caregivers as well during the entire cancer treatment. So yes.
So there is a question, what about musical therapy? Is it true that music at specific hertz can heal the body cellular levels?
Okay. So, uh, sir, here, like this is a very interesting question, and let me tell you that, sir, there are multiple theories available. Also, there are multiple researches have also been done, but as per my understanding, there is no such specific segregation that this type of ragas or probably this type of music can reduce one particular type of emotion. For example, if I'm talking about only fear of recurrence, or probably why me cognition, or probably sometimes very low mood. So, as per the research, I must say there is no specific segregation that this Indian raga or probably this music can help to reduce this type of emotions. Having said that, yes, overall the musical therapy, which also includes mild meditation, mild yoga, and mild deep breathing exercises as well. So everything, if we put together, many researchers has found that this is going to soothe your parasympathetic nervous system, and as a result, surely your stress is going to reduce. Not only that, there is a specific raga that is available in our musical content. That raga, many research has been found that particular raga can be very much helpful for your better sleep pattern. So that, I mean, there is a very solid proof that if your sleep pattern is absolutely disturbed, intermittent pattern, late onset of sleep, you just play this raga music and you practice simple deep breathing, and surely your quality of sleep is going to be better. And what is the reason? The reason is only that your stress is coming down because you are taking care of your parasympathetic nervous system through this music therapy. So, in conclusion, I would like to say all the audiences that music therapy is not only music. Music therapy is a combination of many things. It can be a very regular diet pattern, particular, I mean, how you are managing your day-to-day schedule, very timely, very specific way, what music you are listening, how you are listening, whether the place is very noisy or it's a very calm place, and whether you are consistent or not. So this is a summation of many things. So I'm sure that, sir, if you want to know more about it, please don't hesitate to connect with us through OncoBuddy, and surely there we can conduct very good sessions and we can explain to you elaborately on this.
And Jaitri ma'am, I guess we have also created few contents on this music therapy. It is
Yes, yes, I just
available on our OncoBuddy app also. So
yes,
if people
yes.
download our OncoBuddy app, it will be more helpful to them to know about these ragas.
Yes, also, as I can remember that a few months back, also we have our OncoBuddy Instagram channel as well. So I'll request everyone kindly check our OncoBuddy Instagram channel. There also you will be finding one very small creative content on the same thing that you are interested to know about, then surely it will be very much helpful for you.
So there is a question. What are your thoughts on alkaline water?
So alkaline water, so there are more researches done on alkaline water that it is going to help in targeting the cancer cells, and it will help in faster recovery. So it's all about the pH. So completely dealt with pH. For example, foods that are acidic in nature actually becomes alkaline when it reaches the gut system. Okay, so pH and digestion is correlated here. So alkaline water do help. What I can tell, the best example for alkaline water is our clay pot water. Our clay pot water, which was actually used in tradition, brings down, actually alters the pH of the normal water when it is stored overnight, and it becomes alkaline. And there are very few research stating that this alkaline water helps, but yes, it helps. I will not tell that it doesn't help. Yes, it helps. But that doesn't mean that we have to completely depend only on alkaline water. Alkaline water, it's simple clay pot water. We can make sure that just to be hydrated, we can consume that water. When it comes to the dietary part, there is one trend called as alkaline diet. Alkaline diet, to make it more simple to our audience, especially, I can tell foods that are rich in vegetables and fruits are alkaline diet. And that is what we suggest in Onco diet also, cancer therapy also. So we ask cancer patients to improve their vegetable intake and fruits intake. So basically what we are suggesting itself is alkaline. So we need not go in depth or in more dependency to the alkaline diet or alkaline water. So what is suggested by the onco dietitians itself will help actually.
Yeah, I can see one question. Uh, Caregiver has, thank you, sir. So he has said that I'm from West Bengal. The psychology sessions were truly helpful. Can we book another sessions for my relative? Yes, sir. So I request you to connect with your concerned companion, and you please let her know your relative's name, and surely uh, we can conduct a psychology counseling session for you. For you.
So there is a question from Satyabrata Parida. Ma'am, you spoke about fear in physical intimacy. Please explain.
Okay. Uh, Thank you, Shalini, for pointing out this question. So, as we know that physical intimacy is very important for managing overall quality of life and well-being during a cancer treatment. So, yes, we have multiple myths regarding the same. That during the session we have seen that sometimes the patient is not comfortable, or probably the caregiver is not comfortable while being physically intimated with the partner. So here we need to understand a few things, that uh, consult with your doctor once, that whether this is the right time that you will be able to, having a good physical relationship with your partner. That is number one. And so number two, if I specifically talk about the fear, so it's very much important that if you are completing your treatment, then what is the duration, like how many duration, like how many months or how many days you have completed. So what is very important here, that for women, that during your cancer treatment you should not be pregnant. So apart from that, always we suggest that if the male person is using proper protection, and then surely, and if the female body doesn't want to reproduce right now, then surely that a few things we always need to keep in our mind. That apart from that, sir, there is a thing called vaginal dilator, which is known as VD. So always we say that you can connect with your rehabilitation center. You can also ask your oncologist as well. If you feel that sometimes we call it the penetration is becoming a little difficult because of surely as a post-cancer side effects for the female body, you can always don't don't hesitate to talk to your oncologist about it. Don't hesitate to ask your oncologist about it. So the instrument is called vaginal dilator, and it's available everywhere in all the rehabilitation centers and hospitals. They are surely going to suggest you. Also, the physiotherapist will show you as well that how to use it. So I guess then surely, and all the best to you both.
So, in the middle of our question and answer session, I can see there is one warm hug for Shalini. Shalini ma'am, thank you so much for answering. You have been the best person my wife has met to handle her so calmly and cutely. Understanding her, a very warm hug from my wife, and thank you. So that's great. So in between the question and answer session, there is very good appreciation for our genetic counselor at For Base Care. That's great.
So thank you so much for this, and I really hope to connect more. So in case there is further queries or you want to reach out to me for further questions, we're always available on Onco Buddy, so you can always book an appointment and join there. So one person has asked, what is Onco Buddy? So Jaitri, do you want to emphasize on that?
Surely, surely. Just yeah. So definitely. So Shalini, here we need to so it's, I must say that it's my pleasure to discuss about Oncobody now. So Oncobody is a very important product, and it's our digital healthcare product from our Forbes Care, which is a 360-degree 360-degree digital healthcare platform, and also it helps at building a unified and patient-centric ecosystem to provide a holistic support to the cancer patients and their family members, obviously, to fight against cancer. So here, all the audiences kindly note down, from Oncobody you can book the consultation with your oncologist, and also the psychological diet counseling sessions, genetic counseling sessions, pain and palliative care counseling sessions. Also, you can book from the Oncobody application. Also, you can upload your own medical report, and you can manage those reports as well by yourself. Also, we have a section called community. So in the community section, you can post any query, and our experts, we will always be there to answer and to clear your doubts. So we also know that today there, we know at the end of today's session probably, and we have lot of questions and the queries asked you, but due to the restrictions of time, surely if today we are not able to answer all the questions, then please don't worry. Shalini, uh, Sharmila and me, Jaitri, we all will be available in OncoBuddy, and surely we're going to clear all your doubts over there.
So I guess actually I can answer one more question from the audience side. This is something very important that I need to address here now. So is keto diet healthy? So since I told about fancy diets, now the patient is asking, is keto diet healthy? Can I follow it for weight loss? So to be frank, it is not advisable for any cancer patients during treatment, because the only reason why keto diet is not advised during cancer care is it is an anti-inflammatory diet in nature. It is not safe because it may lead to some nutritional deficiencies, and it may also worsen the side effects of the treatment, and the patient actually may end up in some digestive issues also, which will lead to unhealthy weight loss, which is not necessary during the cancer treatment. So I'd like to highlight, during the cancer treatment, unhealthy weight loss is not necessary at all, and the keto diet may end up in it. So do not follow keto diet when you are on any treatment, and this will also bring down the tolerance well during the treatment. So any fancy diets is not advisable once the diagnosis is done and once the patient is on treatment. Always consult your onco dietitian. We here at Forbes Care are always available for you in the Oncobody app. So feel free to reach out to us for anything and get an elaborated session that is completely tailored for your condition. So we are here to help you out.
So there is one more important question. So patient has asked, if one person in the family has lung cancer, are the other family members at potential risk? So this is again subjective, sir. So basically, first we have to evaluate if the patient diagnosed lung cancer has any lifestyle habits of smoking, tobacco chewing, or any other lifestyle habits. So first we have to evaluate that. So based on that we will determine if the other family members could be at a potential risk. Otherwise, if there is a strong family history in the family, in the running in the family, and the person diagnosed with lung cancer not have any habits, so again we have to look into the family tree, and based on that we will evaluate if the other family members could be at a potential risk or not. So there is another question: can we understand risk for future generation from a block sample testing? So again, we had discussed this in our webinar session, which happened in the past week. So we have two types of genetic testing. One to understand the inherited risk of cancers. The second type of genetic testing will to understand the next generation options. So coming to your question, from the tissue sample, we cannot completely understand the hereditary risk for the other family members. So if there is any on the sample, we can suggest a confirmatory testing which should be done again.
So Jaitri ma'am, so this is something related to the psychology part. So this patient is asking, so how to control my anger?
Okay. Okay. So,
Because too much of chemotherapy sessions like is making me lose my control over my emotions. That is what he mean. So I guess maybe the patient must have irritated because of too much of chemo sessions. They are waiting
okay.
when the sessions will get over.
Okay. Just correct me if I'm wrong, Sharmila. So, the question is that the patient is receiving chemotherapy, and during this chemotherapy phase, the patient is getting angry or irritated, is it?
Yes, right, right.
Okay, okay. So here we need to always focus on the anger management techniques. Also, we need to realize that sometimes the chemotherapy drug itself, this can create a few side effects. For example, lack of sleep at night, or probably lack of taste in your food when you are not able to eat properly, when you are experiencing your nausea, sometimes vomiting, sleeplessness, sometimes constipation, loose motion. And overall, that diagnosis itself, it's not a very easy thing to accept, sir. So first of all, we need to give ourselves adequate time so that our body will be adaptive to the new environment, or probably the new situation and the new drug and the new scenario, new conditions as well. So once you feel that, no, now my body, I have given myself enough time to accept the new thing. After that, the situation comes that which is the anger management. So here, as a psychologist, always I speak to my patient like this: that why is more important than what. First of all, you need to sit down and you need to think why I am getting this angry feelings. Is it because of anything related to my job? Is it because of my diagnosis, or probably my family, my treatment, and what is the actual reason? And after that, sir, I will tell you that try to arrange everything in a descending order, like which cause is very important, which is making me feel angry. Then number two, then number three, and number four. Then only for you will be able to get one clear idea. And number, which is very important, that you ask the question that how you can manage your anger. The the number one tips is that sometimes it's important for us that I need to identify the triggers. Trigger is like, as I said earlier, why I am feeling angry. If you feel that there is one particular thing that is making me angry again and again and again, then probably the moment you face the same trigger the next time, just tell yourself that no, the last time also I was angry, so probably this time also I am going to express my anger as well. So probably the thing is basically the same. So if the same thing gets repeated, then I should not express in the same way. And number two, Sometimes if you feel that, we just call the change the environment. So for example, you are sitting in the dining place and you are having an argument with your kids or probably anyone else and you are very angry. So remember, rather than expressing your emotions then and there, which can be very devastating, just change that environment and probably you go to your bedroom, and whenever you are calming down by yourself, come back to the same place and then have one discussion. So always remember, if you are angry, it's definitely not right to express your emotions then and there, because you know that the same thing happened last time also, and if I raise the same thing again now, then probably I'll be very angry, you're going to shout, you're going to fight, and then it's going to be a very clumsy situation. And the number three, always remember, if you are angry, never try to use any bad words, because as a human being, what happens, like whenever we are angry, we just shout at people and we use some bad words, and after some time we realize and we feel guilty. So also believe in yourself that I should not kind of express anything in a very bad or ugly way, so that later I feel guilty, because guilt is the thing that sort of hampers a person's emotions very intensely from inside. So in summary, sir, I will tell you that first, which is most important for you, number one, identify the triggers in a very descending manner, why I am becoming angry. So that's the first question that you need to introspect, you need to answer yourself. And after that, slowly you can practice, something, as I said, change the situation. Once you calm down, then you come back and explain and have a word with your family members. Things will surely going to resolve slowly.
That's great of you, Jaitri. So I guess anger management techniques will be useful for the caregivers too.
Yeah, absolutely, absolutely.
Okay. So I guess it's time to wrap up. So maybe once again, can you please help the audience recall about the importance of our product OncoBuddy app?
Yes, surely, Sharmila. Why not? So here, before we wrap up, let's now talk about OncoBuddy. So please check our new digital healthcare product, OncoBuddy application from Forbes Care. So which is a 360-degree digital healthcare platform that aims at building a unified and patient-centric ecosystem to provide holistic support to cancer patients and also our caregivers in their fight against cancer. So here, let me tell all the audiences that from OncoBuddy application, the patients can book consultation with your treating oncologist, then counseling session with the psycho-oncologist, oncodietitians, also genetic counselors, your pain and palliative care specialists as well. You can upload and you can manage your own cancer reports and your own medical data. Apart from that, you can also post your query in the community section. Our experts, I mean me, Sharmela, and also our other dietitians, other psychologists, our genetic counselors, Shalini, and their entire team will be there to answer your queries. And just, I guess we have received another question. Just one second. Okay. सो यहाँ पे और एक सवाल है जो शारिक नवाज जी ने यहाँ पे हम लोगों से पूछा है. ओके. So can you please tell my girlfriend it's not safe to do drugs and it has high genetic cancer danger coming on the way. So I guess this question is for Shalini. Shalini, I'll be repeating the question once again for you. So यहाँ पे Sharik Nawaz ji, so he has asked, can you please tell my girlfriend it's not safe to do drugs and it has high genetic cancer danger coming on the way. So how do you explain it to him, Sharik ji ko?
So again, Jaitri, so the question, I think it is best that the oncologist explain the risk. So we are all aware that tobacco, lifestyle habits, comorbidities have certain risk for genetic disorders. But again, I think the oncologist or the treating physicians explain the risk in detail. What could be the potential risk? What are the cancer risk it could have? So I think it would be best to be discussed with the doctor again.
Absolutely, Shalini, I do completely agree with you, sir. So here, sir, हम लोगों को ये समझना पड़ेगा क्या कोई भी ड्रग्स, either it can be tobacco or can be alcohol or can be, for example, smokeless form of tobacco, for example, gutkha, chuna, or any supari. So everything, including smoking, is not at all good for health. And surely this can cause cancer, because the nicotine is the major thing here. It can not only cause the lung cancer but the other type of cancers as well. And surely, as Shalini said, I do completely agree with that. Please contact with your doctors so that also your girlfriend can get a greater clarity. And number three is that if you feel that you would like to have one in detail session with us, like how she can stop or she can quit drug, then please don't hesitate to book one session with us, one counseling session with us, so that we can directly get in touch with your girlfriend as well, so that we can guide her exactly what should be the strategies so that she can stop doing drugs. I guess that's, you have got your answer, sir.
So we've come to the end of today's event here. So thank you all for joining us today. We hope this session was helpful. If you have more questions, like Jaitri mentioned, you can always feel free to reach out through the OncoBuddy app with all of us. Stay strong and take care.
Together we beat cancer.
Together, we beat cancer.
Together we beat cancer.
For the diagnosis that anyone wants to hear. It can be a long, lonely, and complicated journey that can leave you feeling confused and hopeless. But don't worry, I'm here for you. I'm OncoBuddy, your companion in cancer care. I'll be with you to guide and help you on every step of your cancer journey. During this journey, you're going to get all sorts of medical tests, and you'll be flooded with reports, analyses, and other information. OncoBuddy provides you with a simple way to securely digitize, store, and share all your medical records with your doctors and caregivers. Along the way, you'll need to talk with your treating doctor on an ongoing basis. OncoBuddy enables you to easily schedule consultations and connect with your medical provider virtually from your own home. You can also add caregivers to the call so they never miss a beat. Sometimes, it's important to talk with someone about your diagnosis or treatment. OncoBuddy's virtual community allows you to conveniently connect with experts and patients who will share their experiences and help answer any of your questions. And then there's our Knowledge Hub, which gives you access to videos, articles, and other exclusive and curated content on cancer care. Trust me, I know it won't always be easy. There will be good days and bad days. But I'm your companion, and together, we're going to meet this challenge head on. To make me a part of your journey, download the app today.